Good morning, good afternoon, and good evening to all of you, depending on where you're watching us from. And welcome to the Ion Influencers Fireside Chats, where we speak to the sharpest minds from the world of capital markets. I'm your host, Giovanni Amodeo, and today with us, we have Michael Dershem, who is the founder of Apierion, and the topic of today is trends in the healthcare space. So thank you for being with us, Michael.
For sure, Giovanni. I was looking forward to it.
Perfect. So maybe let's start with your background first and how you started Apierion.
Okay. My background, serial entrepreneur, been building companies in the greater healthcare and pharma space pretty much my entire business career. So 25 plus years, maybe even 30 years now, Giovanni, to age myself. And those companies ranged from operations and distribution, biotech startups. I was one of the first movers to put nurse practitioners and doctors in alternative sites like Walmarts and CVS's when everybody thought that was crazy. And, who would go see their doctor at Walmart? But then fast forward during COVID, they were the, instrumental to be the, kind of offense and defense. I was also the CEO of Pharmaset, which was the startup that we did out of Emory University around some hepatitis C technology, which then the company went public, and that led to the drugs Harvoni and Sovaldi, ultimately bought out by Gilead, but for all intents and purposes, eradicating hepatitis C around the globe. We started Apierion at that time. When we founded it about 6.5 years ago, the name was MAPay. We were primarily a payment company, trying to reduce the friction of payments within the greater healthcare and medical commerce. And then, we early on found this niche, if you will, which now has exploded on how we can utilize the data that comes from that to try to bring interoperability to the healthcare market space, which has been void for, forever. And now, so, right now we're deploying some of the probably top utility use cases in healthcare and medical commerce across the globe, based on blockchain, and now, of course, bringing AI into our solutions as well.
Great. So maybe think about all your careers and the lack of data that all those companies have, and the need of data and the different use cases. What were you able to learn back then that you're applying right now?
Right. Well, remember when I started my first one, that was, I think that was either Web 0.5, Web 1, maybe not even Web back then, Giovanni. So, but I think now, everybody talks about data, and it's been going on like that for years. But I think, particularly in healthcare, I don't think that it is primarily a technology issue. I think it's also a competitive issue, because you have data that is siloed off into these competing marketplace players. So in insurance companies, in large system players, enterprises, even some governments in their programs. But because of the competitive nature of that, will they share that data? Can we get to data interoperability? And that, I believe, Giovanni, is probably our biggest challenge. Second to that, I think that, when we talk about data, particularly these days, we have to talk about cyber risk, data breaches. And I spoke a while back on NASDAQ about this, and they asked me, they said, Dersh, why healthcare data? Why do we see this all across the globe? And the reason is because healthcare data on dark web or on secondary markets is worth 25x payment data. Think about that. So it's like that old adage, why in the wild, wild west did they rob the banks? Because that's where the money is. So you have to think about, why do they go after this healthcare data? Because at the end of the day, it has everything. And so I think those are the two things that we think about as we bring solutions. How can we build a patient-driven interoperability platform around digital identity using blockchain and now AI? What are those use cases and utility? And then how do we assure the data structures now utilizing blockchain, which can alleviate a number of these ills that we've had from these legacy type database structures.
So let's talk about interoperability and the first issue. You're creating a platform from the patient point of view. How much can you expand this data, and where would you then store it to make it secure?
Right. Good question. Because often people think that, the healthcare data, is derived from these electronic health records, right? The clinical data. What we believe in our digital medical twin and what we're showing is that it's not only the clinical data, but it's also, Giovanni, it's referred to as the social determinants of health, SDOHs. All those things that are not in your clinical record, but make you up as, your medical persona, if you will. So those things that, again, aren't in your clinical record, things like environmental, genome, geospatial, wearables, all that stuff, right? And you see study after study that says 80 to 85% of your healthcare outcome is based on social determinants of health, not on the clinical records. So I think that's a key as we look at, especially now, when we're trying to use AI or clinicians are trying to use AI or researchers are using AI against that data, we need to make sure that we have, as great a data set that we have, because you could make the argument without that data, then we're going down false pathways.
And onto that, you mentioned the watch, and now the CEO of EssilorLuxottica talked about the glasses being the new smartphone in the future. So how do you connect all these devices to get the best data?
Right. So it's not like one glorious day we're going to flip the switch and everything's going to turn on, right? There has to be an involvement of it. There has to be an opt-in nature on behalf. But I will tell you this, that when we get to, and here's the other issue. When we get to the point where now we as a collective can nearly demand an API handoff of that glass information, of that smart glasses, of that smart wearable, of other information, making sure that we can control our own privacy and our privacy rights and what's being done with that data. It's a huge shift. It's a huge shift. And we talk about it a lot, moving from Web 2 to Web 3 and this whole democratization of data. It's something that individually it can't, it's a yeoman's task. It's taking that, that big rock and trying to push it up the hill. But collectively, when we're able to do it, and then we can build some decentralized finance models to make sure that economically it makes sense for everybody. And structurally and regulatory wise, it makes sense for everybody. That's when we win the day. And that's what we're showing.
That's the theory. Are there enough smart people in the industry to be able to do that in the next, let's say, 5 to 10 years?
The smart people don't look where we are. No, I say that joking because, I would make the argument that the current smart people are trying to keep it walled off in their legacy environments because they've been able to, be at that trough day after day after day. You and my data, it doesn't matter what country you're in, what state you're in, what health system you're in, what insurance company, our data is being sold every day, right? We get nothing. And that's a shift that has to happen. And again, that goes back to, this whole notion of Web3 and where this democratization is happening. And I don't think it's just in technical terms. I think you get a feel for that, because we're working on a global basis. We've been watching elections and population, all across the globe. who would have thought that on Thanksgiving here in the States, I was actually watching the Namibia election returns on Thanksgiving Day. Like but my point of bringing that up, I think that there's a sense, and maybe it came out of COVID, or maybe it's just that there is this rising tide of individualism and trying to assure that that our rights are satisfied, if you will, or at least realized, and just get that feeling. And I think that's that same notion of again moving from Web 2 to Web 3.
You talked about we get nothing for the data, and you talked about democratization. Do you think things will change in the future?
100%. We'll change it. We'll change it, Giovanni. The reason being is because, and we have some patents pending around this, but we think that there's a new way or novel approach of how this data can be sourced, how it can be monetized, and then through smart contracts to assure wherever those purveyors were, that it's not a conflict with them, but it's more of a confluence with them. And I can build that economic argument with them, and we're doing that today. And in simple terms, if there's a seller of big medical data today that's getting 1x, think about it. They're in a competitive environment. It'll never be attached to, their brethren rivalries. However, us sitting at a patient-centric level, being able to feed those in, collecting additional real-world data, that data set itself exponentially is worth more. So that 1x, and if they want to keep on selling 1x, have at it. But I know when they put it into our collective that I can probably get them 4 to 6x. It's simple. It's simple math. It might be complex underneath the scenes, but at the end of the day, just boiling it down, it's simple math.
You talked about insurance providers and the local providers as well. How is that approach changing based on what you said?
Well, we did something interesting. If you think about healthcare commerce across the globe, it's close to $11 trillion. But at the end of the day, there's only 3 real stakeholders. There's patients, providers, and payers, right? Like you said, insurance and government payers, which is pretty incredible. In all of that marketplace flywheel, there's of $11 trillion, there's 3 stakeholders. So what we did was, we're creating a value proposition. It could be unique and distinct for each one of those, but there's a reason why that they will opt into this marketplace initiative. For the provider side, we created the first digital credentialing application. So if I'm a doctor in Bermuda and I want to see patients in Bermuda, and it doesn't matter, no matter what state or country I'm in, I need to be credentialed. I need to be licensed. And that process around the globe, whether it's at the individual clinical level, state level, government level, insurance level, is broken. And so we created the first digital credentialing application. It's up, running, being used today. And we create then the digital identity of the provider as a professional. So we talked about the digital medical twin. Now you see where we're going. We created the digital medical twin, if you will, of the professional. So now all of my professional certifications, all of the things that make me up as a professional, now ride on chain. Dr. Dershem rides on chain. And so I can then permission that to an insurance company. I can permission that to a hospital to get privileges. I can permission that cross-border. I can use that credential to authenticate myself locally, as well as breaking down country borders to provide care. That alone one, it's a value proposition, for those providers, but two, the value that it provides and the authentication of those resources is critical as we look about sharing resources, across border and trying to do that in a much more efficient way, still being guided by the regulatory environment. But it's a huge challenge today, but we're breaking that down.
And how do you make the accreditation uniform across the different countries, languages, jurisdiction?
We are, as many of us say here, Giovanni, we are continue to build the plane as we go down the runway. So it's not all, but great questions. But we have to be at the forefront of those questions, and we have to be forcing those questions. If we started in Bermuda and now moving across CARICOM, and I'll give you an example. Let's say there's a pediatric patient in Bermuda that has a mental health eating disorder issue, okay? And they don't have that resource in Bermuda. But there's, the perfect provider in Jamaica. So you might say, or you and I are talking, at a cocktail conversation, you might say, well, Dershem, that's easy. You just do a Zoom call, right? Not so fast. You're talking about the authentication of that provider. You're talking about the jurisdiction of that data pre, during, and after the call. You're talking about parental permission. You're talking about where that data resides, how you do follow. All of that needs to be in a construct. And then you laid on top of that, how about language barriers and things like that? How is that done? So those are the things that we're pushing forward on, because we believe and we believe that as we create that that plumbing or that network, that others service providers or telehealth people will use that plumbing to make that happen. But yeah, we're I don't see, I mean, maybe there's others out there, but nobody's forcing that conversation like we are.
And are you concerned that, for example, if you were to go down the Europe path, that there is too much regulation in Europe compared to the US or other regions?
I mean, that's a good question. I think regulation is good. I think regulation is needed, especially as it relates to data. And I would say this, that especially in this new age that's pushing forward, that we have to get that right. And sometimes looking at old regulatory structures may not be, the right fit in this environment. So we need to be able to evolve with that. One of the things that concerns me is when we look at lack of healthcare access and healthcare inequities, whether it be in certain regions or even urban areas, or as we have gentrifications in some societies, leaving healthcare resource voids. That's an issue. So if we look at it from a shared perspective, again, we must get that regulatory environment right. We must get that technology right. We must get those fundamentals right, or all else is impossible.
You talked about building the runway while the plane is coming down. So how do you want to
while it's going
on. Sorry. How do you want Apierion to be seen in the market based on what you said?
What we're getting now is, I think it's from our business background that we have as a team, that we've done things in healthcare and pharma that nobody else has ever done, that people thought either were crazy, impossible, and so I think setting that there and then looking at that side that says, here's things that are really broken, here's things that need to be fixed. And if we can get the marketplace to say, and we're getting that now, we're doing some, like in this area of maternal health and maternal mortality, that's the death of the mother during pregnancy, right? Or just postpartum. It's a huge issue globally. It's an issue in the States. Believe it or not, the States we're ranked 11th in developed countries in the death of the market. That's shameful. And so how are we going to fix it? And so what we talk about is we need to get to the root cause. This can't be political. We can't have people on the left say one thing and the right say another. We need to get to the root cause. And if we can get there, so if we have governors or premiers or heads of insurance companies or health systems that are able to say, Dersh, okay, you and your team have solved big issues. We trust you. Let's co-create this together, right? And so now what makes me proud of the CEO is where we're getting that type of engagement in some of these types of what I would call micro issues around the globe, where there's specific issue, rare childhood disease in India that we're working on with one of the major foundations, about ready to get appropriation on it. The big issue, TB resistance in India, big issue. And so how can we attack that by getting the right data sources, building credibility, because there's also, again, because we're dealing with healthcare data, there's also, historical bias, prejudice, things that happen. So what we can do best as a company is to assure that credibility in the marketplace to those individuals and those stakeholders that we can get it done.
Is that the biggest challenge that you have right now?
That's a good question. I think from that perspective, and if you're leaning in a bit to me to say, Dersh, how do you see this thing? I think that there's a difference between aspiration and reality, right? And especially when it comes to tech and when it comes to solutions, especially when it comes to blockchain and now in AI, that there's very hard for marketplace participants as well as individuals to really understand what's aspirational. And there's nothing wrong with being aspirational. I mean, we're aspirational and a lot of it, but we also reality. There's stuff that's deployed where you can touch it, you can feel it, you can see it, it's running. One of our biggest challenges when we talk, to investors or larger strategic partners and the like is they go, Dersh, like we had this a couple of weeks ago, and our team gets it all the time. Like, can you say that again so that it's clear that you have built and it's working and providers are using it, and you created a digital non-fungible token, NFT, as the doctor's professional identification, and it's riding on chain today? Yes. And you're getting paid for it? Yes. And you're expanding it? Yes. Do you know how? And they go, that's crazy because we don't see a lot of that stuff that's real. Like, everybody loves that. So I think that's one of our biggest challenges is to make sure that we're communicating effectively that, hey, what's real today. And we, just like I was saying earlier about this whole marketplace data structure and how that can be done, that's aspirational. But I was with one of our board members the other night, and we've talked about it over the last several years about, I think what we've done well as a company is we've put kind of flanks out there. If you've ever did that board game Risk, where you have the different armies and military and arsenals and everything like that. Yeah. And so we've set that out. And I was on a panel one time, and one of the top IP lawyers in the world, I made the comment that, we're playing 3-dimensional chess, right? Just as, like it's a game board. And she says, Dersh, what are you talking about? You're playing like 12-dimensional chess, and people don't even know that they're in the game with you. And so the point is that what we've done in this kind of game board of risk, we've taken these flanks, whether it be geographically, solution-wise, swaths of populations, in a very, not surgical way, but in a very strategic way to see how we can map that together. And so our board member said to me, they said, Dersh, you know what? Get our designer to take the board game risk, the world map, show our product solutions, show where they're working, whether it's, again, maternal mothers, whether it's animals, whether it's athletes, whether it's Bermuda, whether it's India, and that, to your question, Giovanni, I think that visual will, people be able to say, oh, I got it, right? At least that's what we think.
And one final question as we are approaching the end of the discussion, based on what you said, the 12th dimension, how can you simplify and reduce complexity?
You know what? You're right. That's one of our biggest challenges, is to take something that's complex in nature and simplify it. And the way we're doing that is, for instance, in India, where we are taking school-age children, creating a digital medical twin off of that on behalf of their parents, to them, or again in the US, back to this whole maternal health stuff. Nobody, at the end of the day, in my opinion, nobody really cares what the tech is, like you and I do, and some of your investors do. But at the end of the day, they just want to know that it worked and it fixed something, right? And I think if we focus on that, and we can boil it down to these use cases that we need 20, how many countries are there in CARICOM? 26 countries to be able to communicate on telemedicine and also physical transport between those nations. If we start there and we say, yeah, it's crazy that, I moved from St. Kitts to Bermuda. All my clothes went with me. All my, I was even able to get in a couple, food, but all my healthcare data, guess what? No. And so I think, and sometimes we kind of say jokingly, like, or that's crazy, or that's nuts. That doesn't have to be. And I think if we boil it down to those simple things where people get it, because like I think what you're alluding to, healthcare, medical commerce, human body, data, it's complex, right? And if you're not in it, your head will explode. But for us, I think that is a challenge, how we can simplify even for the patient, the student, the mother, the pet owner, the athlete, the president of a country. How can we boil it down to really simple, tangible things that they can grab a hold of? And I would say that's work in progress. It's challenging.
Great. Dersh, thank you so much for your insights, and thanks everyone for listening.
Yeah. Thank you, Giovanni. Appreciate it.